enough fiber-rich foods such as fruits, vegetables, and whole grains, which are essential for good digestion and heart health. Instead, they are turned into processed snacks and sugary drinks, which do not provide adequate nutritional value. An example of this shift is the increasing preferences for fast food and sugary drinks over traditional Sri Lankan meals like rice and vegetables. This change in dietary habits is contributing to rising rates of obesity, hypertension, and diabetes in both urban and rural population. Impact on pregnant women and elderly. Pregnant women and elderly individuals are particularly vulnerable to the effects of poor nutrition. In Sri Lanka, nearly 25% of pregnant women are underweight, which increases the risk of complications during childbirth and affects the health of the baby. Effects on pregnant women. Low birth weight, including malnutrition in pregnant women, often leads to low birth weight in babies, which can have long-term consequences on the child's growth, development, and overall health. Increased risk of maternal mortality. Poor nutrition during pregnancy also increases the risk of maternal mortality as it weakens the body's ability to cope with the stressness of the childbirth. Effects on elderly. Osteoporosis. Many elderly individuals suffer from osteoporosis due to inadequate calcium intake, which weakens bones and increases the risk of fractures. A poor diet, particularly one low in dairy products and leafy greens, contributes to this condition. Cognitive decline. A poor diet can also lead to cognitive decline in the elderly, contributing to conditions like dementia and Alzheimer's diseases. Ensuring that older adults receive adequate nutrition is essential for maintaining mental and physical health. Following are some solutions and recommendations. Now that we have seen the problems, let's talk about some practical solutions that can help improve nutrition in Sri Lanka. Encouraging traditional diets. One of the most effective ways to improve nutrition is by promoting traditional Sri Lankan diets that include nutrient-rich local foods like jackfruit, kurakkang, and moringa. These foods are not only affordable but also packed with essential vitamins and minerals. Government nutrition programs. Strengthening school meal programs and maternal nutrition policies can help ensure that vulnerable groups like children and pregnant women receive the nutrients they need. Government intervention in these areas is crucial to improving public health. Third one is reducing processed food consumption. By limiting the consumption of processed foods that are high in sugar, salt, and unhealthy fats is essential for preventing non-communicable diseases. Educating the public about the risk of excessive consumption of these foods can help reduce the burn disease like diabetes and heart diseases. Last one is increasing nutrition awareness. By educating communities about affordable, healthy eating is key to tackling malnutrition and poor diet-related diseases. Nutrition education can empower individuals to make healthier choices and improve their overall quality of life. As conclusion, Sri Lanka has a rich history of nutritious foods, but modern habits and economic challenges have contributed to poor nutrition in many communities. From malnutrition in children to the rise in non-communicable diseases, poor nutrition is having a serious impact on public health. However, by making small changes like encouraging traditional diets, improving access to nutritious foods, and raising awareness about healthy eating, we can make a significant difference. Together, we can work towards a healthier Sri Lanka for all ages. Let's take action now for a brighter, healthier future. Thank you.